Hello and welcome to Behind the Headlines. I'm Marty Radovanic. I am so looking forward to this episode because the man you're about to meet, even though I just met him today, right before we started this, is the closest thing that I know of an actual hero. This is a guy that's in a field that we normally associate with wealth and opulence and special position in society. And when you hear more about him and what he does, I think you're going to get an understanding of why none of that matters to him is what he um, is professionally educated to do. And that's what's so cool about it. But enough of that because I'll get myself into a hole here and then he'll tell me how long he's, grew up watching me and I'm going to feel really old. So we're going to move on and let you meet Dr. Zane Gates, an Altoona physician, and you are everything opposite of. I'm not talking about your specialty, about treating people, but why in the world would somebody go to med school, go to college, Pitt, by the way, go Panthers?
Yes, sir.
Why would somebody go to college, go to med school, become a doctor, and then decide that? And we'll talk about this. I know you actually, not long after you started, you had a free medical clinic in a van?
Mm-hmm.
Okay, why would anybody go to be a doctor and do something like that?
Well, that's because you really believe that you really want to help people. Lots of people get happy, making a lot of money. Some people get happy with a lot of fame. But I think the greatest joy is when someone's at their darkest hour and they can turn to you. That's a better feeling than anything you could have on the planet. I mean, somebody who his life's in jeopardy, the people around them that they love and want them not to be harmed and not them to suffer. And in 15 minutes, what it should be, in an hour of your time, you can completely change the complexity of life. And I think that's the most powerful thing that I was lucky to get the opportunity to do and to become a physician.
When you decided, and I'd like to go back and I know you grew up in a public housing project here in Altoona.
Just right down the street from here.
Okay, so you came from not what would be typical, I suppose. And I don't like to characterize doctors as being, some kind of special person. My personal physician, I know where he grew up. I know where he went to school. I know the people that he hung out with. He wasn't born with a silver spoon in his mouth, and use all of those cliches. But still, you grew up in a public housing project. Did you know when you were growing up, A, that you wanted to be a doctor, and B, that you were going to be the kind of doctor that you are?
Well, growing up, in my neighborhood, all I ever wanted to do for my entire life was to be a doctor. I always thought it was cool. My mom said when I was 4 years old, she said, I was at the doctor's office with her, and I said, boy, Mom, I want to be a doctor. And when I grow up someday, I'm going to buy you a Cadillac and become a doctor, And she laughed. And
did you ever buy her a Cadillac?
No, sadly, she didn't live long enough.
Didn't live long enough.
And that's what fueled me
right
to really, being a single parent in the projects, not having any help, never knowing your father. It's a lot to overcome, but it's not, because I've been very lucky that our community has so many people in our community has really helped me to get to where I am today, and has had such an influence on me in my life. That, well, the biggest influence obviously is my mother, but after seeing what happened to her and how she was treated, that fueled it even more for me.
When you say treated, because she lived in a public housing project?
Well, what happened is she had a heart attack, and this is in early 90s, and because it's a geographical thing, and it's because she had a Medicaid card, she didn't get transferred to Pittsburgh to get TPA or angioplasty. So she just had her heart attack, and her right heart died, and she died in the first semester of medical school for me. And that's what has always fueled me, because the biggest thing about the folks that I grew up with and anybody around town is we're so quick to judge people that a lot of people are that that are felt as less. But when you really, really, really get to know folks and know they are no different than anybody else, they care about the same things everybody does, and there's so much beauty in them that people just breeze by. Because I call those folks the trees, right? Because my mom worked as a cook at the church right down the street from here, which is so should be really proud that I'm here talking with you today, because she was a very humble, simple person.
Yeah.
But that's what really fueled me was what happened to her. I don't want anybody to ever feel that way. You know, I lost both my parents because I never had a father by age 23. So
yeah, that's a tough one.
And it was unnecessary. And I don't want anybody ever to experience that.
When I've had 2 heart attacks, my first one was August 1st of 2000. And it was while I was working in Johnstown, working in television. So I had a sense of notoriety because of who I was and what I did. And I remember this like it was yesterday. I was in a medical facility that no longer exists. It's been bought up by a bigger one, but where it was is not as important as the things I'm going to say now. And I was put in basically, which was on the heart floor. I was right across the hall, right across a floor from the people that had bypass surgery, because I'd see all these people come up with all these wires and things and a white teddy bear on their chest, and I didn't know what was going on. But I was in. It was like a storage room. They didn't have any other place to put me, but they put the bed in there. There was no TV in there. And the charge nurse came over and said, I'm just going to keep you over here if that's all right with you, because you don't want to go into the main hospital, you know, because, again, of who I am. President of the hospital came to visit me the next day. The director of nursing also stopped in. And let's be honest, that doesn't happen to every patient.
That doesn't happen to most patients.
Right. And then I remember when I did my first stress test as a follow-up, they were lining us up in wheelchairs like planes on a tarmac, and you would go to where the treadmill was, and there'd be a cardiologist and a nurse, and then the patient would get on it. So I'm waiting my turn. When I get there, all of a sudden there are 3 doctors, there are 4 or 5 nurses, and then I see this nurse pushing this big cart, and I said, what's that? And she said, that's a crash cart. So I'm standing there, and I'm going, wait a minute, hold on a second. And it wasn't because they thought I would need it. They wanted to be sure. They didn't want me dying in their hospital. I'm telling you, that's what all of this was about. Very wonderful people. Don't get me wrong. The care I got was special. But I thought then, this is ridiculous. I'm nobody. I mean, I'm a guy. I was 48, no symptoms, no, good blood pressure. Found out later we had a lot of family history that I didn't know about. Yeah. But the point was, I can understand, because I was getting special treatment only because of who I am. I can't imagine that's why Zane Gates decided to become a doctor.
No, that's absolutely not. And sadly, in this country, do you know we're ranked last amongst all the economically developed countries in healthcare?
Yeah.
In the rest of the world, people are treated with much better equity in healthcare than we are in the United States. It's not even close. Great paper, and I always quote it because I just think it's so powerful, is we spend $1.6 trillion on just healthcare administration.
Not in care. Not in care.
Just administration. Think about it. That's more revenue than the entire car industry. That's more revenue than the entertainment industry, including sports. Just shuffling paper around. And people might say, wow, healthcare's complicated. The rest of the world spends 8 times less. That paper really shows that it isn't that we use too much healthcare. The problem is the cost of the goods and services and the administration cost. Think about it. If you look in the top 25 Fortune 500 companies, 8 of them are healthcare administration companies. You don't even start to get to the providers. I think it's number 78 or 80. I don't want to quote it's wrong, but it's in that range. Then you start to get to healthcare providers, and that's Hospital Corporation of America. You don't even get to a person who delivers the service until you're way down there. So that thing is the key that fuels the depersonalization, because it all starts there.
Sure.
So when you're spending, if there's $1.6 trillion in administrative costs, that means that everybody around them who deliver the care have to jump through all the hoops created by those $1.6 trillion industry.
Yeah, and it's not why. And I think this is fair to say. You went to med school. You would know. People in med school, there are those that are there. Maybe their legacy, their parents were doctors, whatever, and they decided. But most of them are there because they want to help people. You don't go through what you went through.
No.
You don't do all of the, as a resident, and you're working like a dog and all of that you have to do. The kind of physical pain you have to go through just to make grades and in order. You don't do all of that because you think you're going to get rich. I can't imagine you do that.
No, there's a lot easier ways, and if you're smart enough to get into medical school and do all that stuff, you could easily do something else and make a lot of money. You really, truly, to go through the stuff that we have in residency, really want to do nothing more than to care for people. The problem is the system doesn't set it up for physicians and nurses and pharmacists to really do the care that they want to. Now, that's the problem. And it leads to a couple bad eggs on the provider side, gaming the system.
Mm-hmm.
And a lot of the time, especially in primary care, it's just to survive. I'm not saying gaming the system's ever right, but I'm saying when you set up a system that's built off of insurance and not built off care, you're going to end up with these kinds of results. And that's the toughest thing to fix in this country, because people don't understand. We're on the brink of a crash, and it's not a policy problem, it's a math problem. And here's the reason. You can't continue to call something that's insurance, because that's what we buy. We buy insurance. That 80% of the people under the age of 65 who buy it use it. Imagine if 80% of people who bought cars wrecked or burnt the house down. It doesn't work.
Right.
Eventually, we've been fighting this for years and years and years, but now I think we're getting to the point where it's going to all come to a head. And the prediction out there was by 2030, the average family premium will be higher than the average median income. And they think now that's even going to be shorter than that. So that's what's scary about all this. And
yet you can't exist in today's health marketplace without it.
Nope, you cannot.
I mean, because we've been blessed. My wife and I have been blessed. She worked for the University of Pittsburgh, by the way. So she's got good benefits. We've been a UPMC. We are still a UPMC because of, and she retired. We have one of the best healthcare plans, and we pay virtually nothing for it, which is a blessing. The point is, when I get treated, and I've had 2 heart attacks, I've had heart bypass surgery, I have lymphoma. Currently, as I tell people when I go in the main hospital in Johnstown, I know most of the staff on a first-name basis because I've been there so much. Point is, we're blessed. I get my statement that this latest echo and stress test, if I was paying it out of my own pocket, and again, I understand that the price you see at the top is the price they set so that they get paid the percentage they get paid. I understand, but still, I'm getting a lot of expensive health care for virtually nothing. I'm blessed. We pay per person $29 a month for our health care. Okay,
that's like beyond blessed.
Yeah, and it's like a Cadillac plan. All right, I mean
that's like people who have Cadillac plans look at you and go, "Wow, no, that's a Cadillac."
But the point
it's
is,
beautiful.
There's so many. We're blessed, and I don't deny that. And thank God, we did something right to be in this position. I firmly believe in that. The point is, there's so many people who aren't in that position, and I want to. Most
people.
And this is why when you hear, like the word Medicaid is like, it's like a 4-letter word to some people. It's like, because they think they know everything that Medicaid is. Would you agree with me that they really don't have a clue?
No. The thing is, Medicaid now is the coverage for the working poor. 92% if you take away kids and you take away disabled and you take away people who care for their parents, are working. That's the thing that just blows my mind. Is like, we're going to get a work requirement. Okay, 92% of people
are already
working. So you're going to make states go through this crazy gyrations to prove that they work. And,
And
here's
you-
the problem with it. And here's the problem, Marty, that's really, I think, really powerful is so that waitress and bartender, right, pay taxes and do everything, should be treated differently. Even though this waitress or this guy may work for a small automotive shop,
Mhm.
and the guy with the big automotive shop is able to get insurance from his big automotive company. The guy who has the same training, same skills in the automotive shop, he, because of what he makes, he might be an out front clerk, he gets Medicaid. Now, this guy doesn't have to verify his income
Right.
every 2 months. He doesn't have to be made to feel when he calls a doctor's office and they don't accept it. And doctor's offices can accept it, unfortunately, because it pays so low, they wouldn't even be able to stay open if they took as little as 5% of it. So it's not that they don't want to take it, it's just they won't be able to feed their family if they
Right.
take too much of it.
Yeah, and
So this, it creates health inequity. You have two people, same person, same skill set, same income level. One's a Medicaid patient, one works in a big company. He gets his coverage through his employer because his employer is big enough to provide it. And how this guy's treated compared to this guy, it's inhumane. It's not fair.
And yet, you used a perfect example. Your mother had a heart attack, and because she had a Medicaid card, she couldn't get the kind of quality care that she needed that wasn't available where she was. Am I being accurate so
Yeah,
far?
you're being 100% accurate.
Okay. So she had the only health insurance, and she was working. And are you an only child?
Yeah, I have an much older brother.
Okay, but point
Yeah.
is,
Essentially, it was just us.
yeah, it was just you and your mom, right?
Mhm.
And so she's working, just trying to
Make
keep
ends
you
meet.
alive,
Yep.
feed you. So she has a job,
Yep.
but she qualifies for Medicaid because she's not getting rich off that job.
No.
And she has one of the most, I don't want to call it popular, but one of the most, there are more heart attacks in this country than any other health incident, at least to my knowledge, and health or heart.
We're
heart attack-
terrible in America.
Yeah,
Terrible.
heart and cancer go back and forth 1-2 as to what kills more. Let's just say that bad hearts kill a lot of people. Almost killed me twice. Point is, she's doing everything she's supposed to do under the rules that we have established. And in essence, she died because she couldn't get the quality of care because she didn't have the fancy insurance plan. Am I
Correct.
making this worse than it is?
No, I mean, it just.
How is that fair? How is that equitable?
It's not. And it's gotten worse since the stories I could tell you about, so many people who are dying so unnecessarily, simple things that easily could have, gotten care. And these are good, hardworking
Yeah.
people.
Yeah.
And I'm like thinking, why are we beating these? These are the folks that are the backbone of society. It's the thing that bothers me most, and I don't know what happened. Where has the honor been lost in somebody that's a waitress? Where has the honor been lost in somebody that works as an out front clerk? Why should they be deemed as less? These people, they raise families. They're good to their neighbors. Why are we treating them like they're less? And that's what bothers me. It bothers me the most. It's inequitable to treat anyone like that, despite through their walk of life. But it's even worse, the people that are paying taxes and can't get the care, the basic care. We're not even talking just the basic care, like a cholesterol pill to prevent them from having a heart attack, or a stroke, So that's the things in this inequitable. And that's why, I did the free clinic. And that's why, today I have my Gloria Gates Care shirt on. And
Tell me about Gloria Gates Care. What is that?
well, Gloria Gates Care.
Gloria Gates is obviously your mother.
Yeah, I named it after my mother. And it's designed really to help the working poor and small businesses be able to take care of their folks. It's a new model because what I learned as I go back is, and I did a TED talk that really talked about this, is what we do at Gloria Gates Care, we design the care first. Then we figure out what the insurance is. So we're able to offer, it's an insurance-less office, so doctors can spend our providers, our nurse practitioners, our physicians can spend a lot of time with patients because we're not paid on a fee-for-service business. We're paid a flat rate from the two plans we take now are UPMC and Geisinger, and somebody could just come in and get it themselves. We provide all the primary care. We have a pharmacist. We have a clinical dietitian. You have all your labs, all your radiology, including MRIs and CAT scans, stress tests, echoes, all your generic drugs. And it's one flat price and has no copays and no deductibles. It's so funny how it's changed in healthcare. It's like I equate it to a gym. We're like a gym membership, right? But the current healthcare system, the gym membership's like, okay, I paid the gym membership. Well, now I'm going to run on the treadmill. Well, wait a minute. That's going to cost you $10. Well, wait a minute. I just paid $50 for a membership.
Right.
Well, no, you got to pay 10 for the treadmill. And then we got to make sure that your insurance company will pay for you to get on that treadmill. Wait a minute. I just paid no. And that's what I liken it to. We remove all those barriers to care. We get it back to, you got a clinical pharmacist. You don't see that in your office. I used to be a pharmacist many years ago.
Right.
And I know the kind of care that they give, and we need them because 50% of people don't even take their drugs. And we're focused on, the Medicaid population. That's one of our focus. We can help people uninsured get coverage. And we also have plans to help small businesses to be able to help their employees afford the kind of care that is without copays and deductibles and is affordable and manageable. We want to start a revolution of taking care of those trees, as I talk. The waitresses, the bartenders, the lawn guys. These people are trees. They give us oxygen. They give us life. We drive by them every day and they never complain. They just take it because they're the strongest and best part of our society. You look at, like my mother, you get on all these talking heads on TV, and they're talking about all these things political and all these things elitist, and they're forgetting about the simplicity and the beauty of those folks. And we all should be fighting for them. And that's what I've been doing for all these years. Is
that sustainable, though?
Yes, my model's sustainable because it's a different mathematical model. What you're doing is healthcare, this is the truth. Healthcare is cheap. It's made expensive by the insurance engine that drives it. And healthcare and insurance should never be together. Again, how could you expect to be able to have a stable financial model using insurance when 80% of the people who buy it use it? Insurance is real simple. It's a formula, right? It doesn't have a heart, doesn't have empathy. It's a formula.
Right.
And it predicts risk. Whenever you have an 80% usage rate, the premiums are always going to be super higher, and you're always going to use, it's always going to predict that you're going to use a lot more than you ever do. Buying healthcare directly is cheap. It's inexpensive. Cheap to me means it's less. No, it's inexpensive. It really is. And by setting up this new membership model and have the insurance around it, like we work with Geisinger and we work with UPMC. With Geisinger, they have many different plans, and we're included in it. So we have the ability for a small business to get, all this, get back to getting the care with no copays and no deductibles. And soon, in about 6 to 8 months from now, it's all going to be in one place.
Is that what they call it, the Hippocratic Oath? Isn't that's basically if I'm a doctor, I'm here to care for you.
You got it.
And not worry about how much does it cost to care for you. And I'm not blaming. I mean, these things are expensive. I mean, an MRI machine, just to buy one, you're not going to go down to you're going to walk into Sheetz and say, give me the purple one because I really like it. I mean, the equipment and all of that, it's expensive. And we've run out of time. Ryan, is it going to be possible to do another one of these right after we do this one, do you think? Yeah. Okay. So I'm going to say goodbye to you now, but because you've opened up this vault of things that I want to learn more about. So do you have enough
I
time
have enough time.
to sit here and we'll do it? All right. So that will be the end of this first episode with Dr. Gates. But next week, we're going to do a second episode because I think there's a lot to talk about here that people are going to know. So stay tuned for that. But thank you for joining us for this episode. We'll have more with Dr. Gates next week. Don't miss it.
Thanks for having me.